Hi, welcome to Agni Nursing Academy. Key. Then this is the good news, that is RML vacancies again came. That is around 422 vacancies are there. You can see here, and these are unreserved. Okay, see you unreserved posts are 169 are there. You can compete with this 169, and these reserved categories are for only the particular state that hospital belongs to which state. Okay, move on to the next question. First question: what is the usual negative pressure range used in the vac therapy? In this question, they ask on the how much pressure we have to use in the vac therapy. That is in negative pressure. Okay. First of all, we have to know about the vac therapy. What is this vac? What is the long form of this vac? Means vacuum assisted closure. Okay, sorry, closure. Vacuum assisted closure. VAC, vac therapy. Okay, we can also in clinical setting they will use like as vac dressing. Okay, then one more short form is there, NPWT, that is also known as negative pressure wound therapy. Now you can show that how why this therapy is using for means we are using the negative pressure and for the treatment of wound. So you can understand this one. Okay, then coming to the vac therapy, you can see this image. Okay, negative pressure therapy or vacuum assisted closure. Okay, see here you can see the wound also here. This is your wound, this is the going to the treating it, and here the one machine is there that is maintain the negative pressure. Then here one container for the drain collection, whatever it coming from the wound, it will collect here only. Then one tubing also there for the negative pressure suction, and here one small foam dress is there. This foam means it will like a sponge. It will absorb the whatever fluid collected in the wound. It will absorb and it will come through this tubings. Then again here one more dressing is there, that is airtight seal. That is we have to seal the air. We have to create the vacuum inside that wound. That is effective because you are creating the vacuum means there is no air leak. There should not be the air leak. Then you can see here foam pad is there and airtight seal also be there. Then what is the pressure, normal pressure, and this pressure is depend on the wound and doctor's orders. Okay, but the is standard pressure is that is minus 75 to 125 mm of Hg. This is the standard pressure we can use up to 125. That is also particularly if asked the single means you can select the 125. Okay. Then move on to the how it will work. How it will heal the wound means it will, okay, it will remove the exudate. Okay, exudate from the wound, and infectious material whatever it is in the wound, it will remove through the this negative pressure. Then it will reduce the edema also. It will reduce the edema. How means if swelling is there, edema is there, means by the negative pressure all the fluid will absorb in the particular here in the vacuum. It will come through the this negative pressure. Then after that it will increase the it is promote the wound healing. Okay, promote the wound healing. How it will help means it will divert the blood vessels through the towards the wound. Because of this negative pressure all the blood supply will increase to the particular area, and it will help to wound healing, faster the wound healing. Then coming to the how much frequently we can change the this particular dressing means we have to change to 48 to 72 hours. 48 to 72 hours we can keep the dressing. After that we have to remove this one. Then one more point is this is standard one, but in the some condition according to the doctor advice it may be changes. Then in what all are the conditions it will use means uses in the pressure ulcer we can use. This is a pressure ulcer. In pressure ulcer we can use, and diabetic ulcer also. Okay, diabetic wound. Okay, Then one more, that is acute and chronic wound therapy. Okay, acute and chronic wound treatment. Then next one, surgical wound therapy. Okay, surgical wound treatment. Okay, surgical wound we can also use. Okay, these all are the conditions we can use the vac therapy. This is your vac therapy, that is you have to know about the long-term marks of vacuum assisted closure and negative pressure wound therapy, and this is the answer here. That is the standard pressure, that is 75 to 125, and particularly 125 is the particular negative pressure. Then how it will work means it will remove the exudate from the wound and infectious material and reduce the edema and increase the blood supply to the wound. Then that we have to change the dressing uh, from 48 to 72 hours. Then we can use in the acute and chronic and pressure ulcer and diabetic ulcer and surgical wound also. Then coming to the options, option A is 10 to 20, this is too much low, and 25 to 50, this is also not answer. Answer of this question is 75 to 125. Okay, this is the answer of this question. Then move on to the next question, that is which lumen is used to administer the hypertonic TPN solution from triple lumen CVP line. See, this question is on the CVP line. Okay, CVP, central venous pressure line. See in this one here you can see the CVP line. Okay, this is your CVP catheter. See already here on brown color is there, blue color port is there, white color port is there. See in the question already triple lumen means these three lumens are there, and this is the site of insertion. Consider this is the site of insertion. Consider this one, and after that, see this is the brown color port. See you can see the brown. This is brown color port lumen. Consider this is here the site of insertion. You are inserting the catheter up to here. See tip of the. This is the brown color. This is went inside the vein up to this much long. So this is the largest lumen of the CVP catheter. Then coming to the next one, this is the starting point. This blue is there. Na? This blue is up to here, middle of this port opening will be here. Then white one is there. Na? White is here only. It is the proximal. Okay, here. See, considering the point of insertion, this brown color is there. Na? Brown color is the distal to the site of insertion. Then white is proximal to the site of insertion, and blue is the median to the site of insertion. Then coming to the one more thing is there, that is this brown is there. Na? This is 16 gauge. Okay, and this white and blue 18 gauge. Okay, size of the catheter. Then coming to the points, distal one, I told you, distal one brown color, and this is the largest lumen. I told this is the largest lumen and 16 gauge. This is used for the CVP monitoring and blood monitoring. Okay, blood administration. Okay, don't confuse it. Okay, blood administration. Then coming to the proximal. Proximal means near to the insertion site. Those here already I have here mentioned insertion site, closest. Okay, closest to the insertion site. This is 18 gauge. Okay, we can in okay. Then this is sorry, this is not the this is 18 gauge, and this is closest to the site, and we can infuse the medications. Okay, regular medications, and for the sampling also. Okay, sampling. Then coming to the medial one, this is also 18 gauge, and you can use the hypertonic solutions like a TPN. Okay, this is the points you can note down, or you can take the screenshot of this one. Distal means this is the largest, and one more trick is there. See, you can see this one brown color is there. Now this is like a red color, and brown B for blood. Okay, brown for blood transfusion. Okay, blood administration. Don't confuse with the this blood sampling in the white color. Okay, this is your CVP line. Okay, then coming to the options, that is distal lumen, option B proximal lumen, medial and lateral. See, there is no lateral. Okay, this is wrong. Then coming to the distal one. Distal one I already told we can use for the CVP and blood administration. Okay. Then proximal means the smallest one, and this is near to the insertion site. We can use for the medication. Then medial we can use for the TPM. Okay, this is your TPM. Then coming to the correct answer is correct answer. This one the question is median. Okay, so medial lumen. Then move on to the next question. That is the nurse is passing a nasopharyngeal tube into the adult and passing the tube through the pharynx, and nurse has asked the client to sip water through the straw. What is the purpose of this action? See here, nurse is passing the nasogastric tube to the patient. While inserting, she will tell to the patient that is swallow the water or sip of water. Why she advised this one means, first of all we have to know the NG tube. Okay, sorry, NG tube. What is this NG tube? N means nose, G means gastric, gastric means stomach. Okay, so nasogastric tube, we are inserting the tube through the nose to the stomach. Okay, nose to the stomach. This is the NG tube. Then while inserting the tube, she told to sip of water. Okay, she is why she is telling the sip of water means to swallow. While inserting the NG tube, she insert the tube through the nose. Then after that pharynx. After that here pharynx will come. Sorry, larynx. After that here divided into the two. Here trachea and here esophagus. Okay, esophagus is there. So we have to insert this NG tube into the esophagus, not the trachea. So here she is inserting through the nose, and after that pharynx. Here comes larynx. In the larynx, one part is there, that is epiglottis. Okay, this epiglottis helps to close the trachea while swallowing. Okay, this prevents the entry of the particular liquid things inside the trachea. It will prevent the entry of the hard material, whatever water and foreign body. It will prevent. Okay, so here she is inserting. So this NG tube is here in the larynx. Now she told to sip means swallow the water. This swallow will help in the will help. This swallow will help to close the epiglottis. By closing the epiglottis, so prevent the tube entry to the trachea. Okay, closes the trachea. Then after that, again it will make the pathway to the esophagus. Okay, pathway to go into the esophagus. Pathway for NG tube into the esophagus. Okay, this is the answer of this question. Okay, here you can, by swallowing it will closes the trachea by the epiglottis, and swallowing also helps to helps the NG tube to enter into the esophagus. Then coming to the options, first one, to prevent dehydration. She is giving the sip of water. Through this one, there is no treatment for the dehydration. Okay, we are doing the procedure, not the dehydration treatment. So this is also wrong answer. Then divert the client attention. So it may be, but it's not the strong thing to divert. So this is also wrong answer. Then to lubricate the tube. So this is also the wrong answer. We have to lubricate the tube before insertion. Okay. Then answer of this question is close the epiglottis. Answer of this question is C3. Then how you have to measure the NG tube? That one, next formula is there, NEX. N for nose, N for nose, E for ear tragus, okay, earlobe. Then X for xiphoid process, okay, xiphoid process of the sternum, okay, NEX formula, okay, N for nose, earlobe, and xiphoid process, ZP sternum you can also call. Measurement, you have to hold the tube from the nose and you have to measure through the earlobe. After that, here ZP sternum. This is your measurement of the NG tube. Then how you have to confirm the correct placement of the this NG tube? There are three ways are there. First one, auscultation. Auscultation, how you auscultate? We have to by using the 10 to 20 ml syringe, we have to push the air. 10 to 20 ml air push. We have to auscultate the sound of oozing. Okay, oozing sound we have to listen. This is the old method. That is traditional method. Okay, remember this one also, traditional method. Then next one, second one, okay, aspirate method, okay, aspiration test. See, after inserting the NG tube, we have to with the syringe we have to aspirate the content of the stomach, okay. If content is like a cloudy and greenish color, okay, greenish color means that is gastric content, okay. It means it is in the stomach, and we have to check the pH of the content, okay. We have to check the pH, that is will be less than 5.5, okay. pH will be 5 less than 5.5 means it is in the stomach. If the pH is if the pH is more than 6 means it is in the intestine, okay, intestine or lung. This is the most common we can use. This is most commonly used measurement to check the placement of the altitude. Then coming to the last one, conformative. How we have to confirm this one with the chest X-ray? Okay, we have to check the correct placement of the tube. It is in the stomach format. This is the your placement. This is the conformative. Okay, there are, see in this explanation you can see the three questions: traditional method, auscultation, then most commonly used aspiration test. Every time this one make it as a question. While before the tube feeding, we have to check the aspiration test. Every time we can't check through the this X-ray. Okay, once you confirm the placement of the chest tube, this NG tube, after that you can use the aspiration test. Then this confirmative test is chest X-ray. Then this is the answer of this question is 3. Then move on to the next question, that is nurse need to discard the tablet methotrexate. Okay, see here, this is methotrexate, and which biomedical waste bin the nurse will use to discard this tablet. See in this question, see here in the question they asked methotrexate tablet. This is a tablet where we have to discard. See, first of all you have to know about the methotrexate. Methotrexate is the cytotoxic drug. Okay, cytotoxic. This is the used in the cancer treatment. Okay, so in this usually you will discard the tablets expired drugs in the yellow bin. Okay, yellow bin we will discard the tablets expired drugs, we will discard in yellow. Then coming to the options, red bin. So this is not the answer. And blue bin, this is also not answer. Red bin we will discard the plastic content and rubber goods. Then blue, that is glass waste, we will discard in the blue. Then coming to the yellow, there are two options are there in the yellow bin with the cytotoxic drugs and yellow bin with the biohazard label. See, this biohazard label should be there for all the bins, okay, but here cytotoxic is there now. This label should be there for the particular cytotoxic drugs waste. Okay, then answer of this question is B, yellow bin with the cytotoxic label. This is the correct answer of this question. Then move on to the next question. At which spinal vertebral intercepts interspace lumbar puncture not performed? At which spinal vertebra lumbar puncture not performed? In this question, they asked not performed. Don't confuse. Not performed. These words are the key words of the question. Not okay. Not need to. Okay. Most one. Least one. Okay. Least one. Priority. Okay. This is a priority and excluded, included, and expect, except. These are the keywords of the questions. Okay. Don't confuse keywords. Then coming to the lumbar puncture. Why we have to do the lumbar puncture? Lumbar puncture. Why we have to do lumbar puncture? Um, to collect the CSF. Okay. To collect the CSF, cerebral spinal cord. This where this CSF is there means around the brain and spinal cord. Okay. Spinal cord. That is particularly in the okay subarachnoid space. Subarachnoid space. So we have to insert the needle into this subarachnoid space and we have to collect the this CSF. We have to insert the needle to the lumbar region of the spine and to avoid the injury to spinal cord. Okay, to avoid the injury to the spinal cord, we have to insert the needle below the level of spinal terminal. Okay, spinal cord, terminal part. Okay, terminal point, that is conus medullaris. Okay, medullaris. This is the point which the spinal cord ends. This is the end of the spinal cord, conus medullaris. Below this region, we have to insert the needle and we have to collect the CSF. Then coming to the site, that is this conus medullaris will end at the level of L1 and L2 in the adult. Okay, don't confuse. Then coming to the sites of the LP. Okay, first one is L1 to L2, then L2 to L3. Okay, L3, L4, and L4, L5 also we can collect. See here spinal cord is there here in the L1 and L2. Spinal cord is there. Okay, spinal cord is there. So injury can there is a risk of injury. So we are not safe in this area. Okay, this is not safe. L2 and L3 this is safe, but this is too closer to the spinal cord. Again there is a risk, but not risk. We are not supposed to take. Why we have to go through the risk one? We can use the L3 and L4. This is the safe and standard. Okay, this is a standard and clinically used. In clinically, this side is using L3 and L4. This is the standard and clinically used one. Then L4 and L5, this is a safe and we can accessible. Okay, accessible. But clinically L3 and L4, L5 we can use if in the question if they given here not given the L3 and L4 means we can select the L4 and L5, not here. Okay. Then coming to the options of these questions, see not performed means L1 and L2, then it's not safe. Okay, this is the correct answer of this question. Okay, L1 and L2, L3, L4, L5 we can use. Okay, this is the same. Correct answer of this question is A. Then move to the next question. Which auscultating, while auscultating the patient breathing sound, which among the following finding required us to report to the doctor immediately? Say again, keyword is there immediately. This is the priority question. Then here they are asking on the breathing sound. First of all, you have to know about the normal and abnormal breathing sounds. Okay. First, move to these are the normal sounds. Okay. Normals sounds, breathing sounds or lung sounds. If you auscultate the lungs means you will hear the vascular sound. Vascular sound you will hear in the peripheral area of the lungs. Then what are the characteristics of this vascular sound means soft, low pitch and longer on the inspiration than expiration. The sound is on the inspiration, okay? More on the inspiration. This is vascular and this is the normal sound. Then coming to the bronchovascular, okay? Vesicular. Bronchovesicular. See here two words are there, broncho and vesicular. Broncho means bronchus or trachea, okay? Then vesicular means lungs. So this sound is we can hear in the major bronchi, okay? Where the trachea will divide. We can hear this sound. Then this is the medium pitch and uh, we can hear this on the inspiration also and expiration also. Okay. Then third one is bronchial. Bronchial and tracheal, these two are same only. We can hear the sound on trachea itself. Okay. Here only we can use. We can hear. Then characteristics of this sound is loud, high pitch, and harsh. Okay. This is also longer on the inspiration. Okay, these are the normal sound. You can take the screenshot of this normal sound. Okay, I will remove this point. You can take the screenshot of this image. Then move on to the adventitious breath sounds. Adventitious means abnormal. Okay. If you hear these sounds means we have to inform to the doctor. Then in that only they are asking immediately. So first one is crackle sound. Crackle sound is this is the popping sound. When we can hear this sound means fluid in the alveoli means pulmonary edema. In the pulmonary edema, we can hear this sound. In pneumonia, heart failure also. If heart failure means there is a chances of pulmonary edema. Then nursing action is report, but not the urgent as stridor. See, we have to report this one because the heart failure condition also there and pulmonary edema also there. So we have to inform to the doctor. Then coming to the stridor. This is a harsh and high pitched during the inspiration. When it can happen means there is a foreign body obstruction or upper airway obstruction we can hear. Upper airway obstruction. That is foreign body obstruction, okay. We have to also upper airway obstruction happen when there is a respiratory failure also there means. So we have to inform immediately. Okay, this is a more severe condition. There is a obstruction in the upper area. Then coming to the wheezing sound, we can hear like a musical during the expiration, musical sound during the expiration. That is when it can happen means when the trachea is become narrow, bronchus become narrow. That is in asthma and COPD we can hear the wheezing sounds. So this wheezing sound is normal in the asthma. So we have to monitor and we can treat it the bronchodilators. Then coming to the D vesicular, this is a normal one. Okay, normal sound, there is no action. Okay, this particularly stridor you have to remember. This is the life-threatening condition. Then coming to the options, crackles. So this is also the then first we have to discuss vesicular means this is a normal one. Wheezes, this is in common in the asthma patient. So no need to inform immediately. Okay. Then stridor and crackles we have to report, but priority is stridor. Okay. Answer of this question is stridor. Option B. Okay. This is our MCQ session. I'll come in the next session and important questions. You can download the Agni Nursing Academy app from the Play Store and subscribe for more videos and more information and notification also. Thank you.